So the first step in the clinical judgment model is recognizing cues. And this is where we figure out what's most important. And unlike the old NCLEX, you are going to have a lot of cues to sift through. So we're going to kind of click through these case study tabs together. And I want you guys to get really practiced at reading this and kind of envisioning this in your mind. Picture this patient. Picture what they're feeling, what they're saying. Kind of keep this visual in your mind because that's going to help you know, what do I need to feel most urgently about addressing? So we're going to read this together. Picture that in your mind and start to think about what is the priority problem here. Be on the lookout for those priority problems of your ABCs. And then keep in mind that these case studies do unfold. And so you're going to be told when they unfold. Here at the top, you're going to say, the nurse has entered a new nurse's note at this time. And each time the case unfolds, revisit that mental picture and see if you need to think about it differently. Because your patient they could start in the emergency department and then be admitted to the OR, or they could even be discharged home from the hospital and this care continues. And so knowing where you are and what resources you have is going to affect how you answer the question. So, all right, we're going to read this together. I'm going to highlight things that kind of stand out to me, and I want you guys to be thinking about any issues of ABCs that you see and then call them out in the chat. So, all right, we've got this 57-year-old client. He's in the emergency department. He's saying he's been feeling short of breath and has had a cough for the last couple days. He's been sleeping on 2 pillows at night, and he wakes up coughing several times a night. He's been feeling very fatigued, and he spends most of the day in the bed or the chair. So keep this picture in mind as we're building and getting more information. This man who's 57, maybe he came in from work for this or has been missing work. He's short of breath, he's coughing, he's upright, he's anxious. So keep this in mind. We're also told he's got quite a bit of medical history, all of these cardiovascular risk factors, right? Hypertension, hyperlipidemia, angina, and diabetes. He's also concerned that he is unable to afford his medications. So a lot to think about here, and be keeping in mind what your priority problem is. So we go in to assess him. He's oriented, that's good, but then we have crackles in all lung fields, so our breath sounds are not clear. We have an S1, S2, and an S3 present, and those of you who know, tell me, what does an S3 mean? That should tell you something specific. So what does that finding mean? Then our bowel sounds are normal active, our cap refill is normal, our pulses are normal, but then we've got 1+ pitting edema in our bilateral lower extremities. So adding to this picture of this guy who's anxious, coughing, short of breath, when we go assess him, his legs are puffy, he's got crackles in his lungs, and he has an extra heart sound. So there's quite a bit going on here. Then we go take his vital signs, and our temperature is okay. Our pulse is a little elevated at 115. We're a little tachypnic at 25 breaths a minute. And then our blood pressure is a little high at 149/93, and our pulse ox is 89%. So I agree with those of you who are calling out crackles and shortness of breath as big priority problems here, and those are definitely issues of breathing. So here we're being asked to select the top 4 findings that require immediate follow-up. And so this is stuff that I need to address this right now. This is not something that can wait. And so we're going to go through and we're going to decide whether some of these do or do not definitely fall into our top 4, but a little NCLEX tip for you. If you're ever asked to select a certain number of options, make sure you select all of them. So pick all 4. Don't pick 3, and if you have to guess on the 4th one, just go ahead and guess, because on these items you don't actually lose points for selecting an incorrect option. You just miss points you could have gained, versus regular SATA items where if you select one that's wrong, you get points off. So in regular SATA, only pick the ones you're absolutely sure of, but in select N, like this, pick all 4 or pick all 3 or however many you're being asked to. So let's pick 4. And I'm going to go ahead and say you guys have chosen, all of you have said shortness of breath and crackles. So I'm going to agree with you and go ahead and pick those 2, crackles and shortness of breath, because this is what we identified as our big problem. This is an issue of either airway or breathing, and we'll talk about that. But he can't breathe, and when we listen to his lungs, when you hear crackles, that means that there's something happening where that air is trying to move in the alveoli. So there's something that's getting in the way of his breathing, and that's creating some other problems for us that we saw here. So let's consider which our other 2 might be. So the cough. Is the cough something that I'm going to immediately follow up on. This is where I would say, yeah, cough kind of sounds like a respiratory finding, right? So if you don't quite understand how to prioritize, you might want to address that first just because it's respiratory in nature. But how would I follow up on that? What would I do about his cough? Like give him a cough drop, give him a gargle. None of these things seem really high priority, so I'm going to hold off on that. Only pick that if I don't have any other respiratory findings. Then the edema. So we're told he's got pitting edema in his lower extremities. Now this is problem, right? This is not a normal finding. This is a problematic finding. But again, how would I follow up on that? Would I just elevate his legs? It's not something that seems urgent. So we will come back to this one maybe. Then respirations. Several of you guys pointed this out as well, and definitely. So tachypnea, remember, is one of your early signs of hypoxemia. So this is compensatory. He's breathing quickly, trying to get more oxygen in because his pulse ox is low. And several of you guys have pointed that one out already. So yes, together these 4 findings tell us that we have got a priority respiratory problem. So he's short of breath. When we investigate further, we find he's breathing fast to compensate for a low pulse ox. And that's probably because at the level of the alveoli, there's something there that's creating crackles. So I agree with these top 4, but let's consider the others. Blood pressure. Now, a couple of you chose this one, and this is an abnormal blood pressure, right? But is this abnormal for this patient? And this is where you have to keep the whole big picture in mind. And so this guy, remember, he has a history of hypertension, and we don't even know that he took his medications this morning. He's been struggling to afford those, so he might not have even taken them. And this could be just a normal blood pressure for him. Or he could be stressed out. He's in the emergency department after all. So it's not high enough for me to be too concerned. If he had warning signs of dangerously high blood pressure, like headache or blurred vision, then I might be worried. But he doesn't. Don't read too much into it. We only have a high blood pressure. And so that's not more concerning to me than these respiratory findings. Then his inability to afford medications. This is very important to address at some point before he's discharged if he is admitted. And so right now is not the right time. If I'm going to call a social worker in to come talk to this guy about available resources, he's not going to hear any of this. He can't breathe and he's anxious, and we can't wait, right? So it's not this one. And then the history of chronic stable angina. So that is probably contributing to his symptoms right now, but like the others, what am I going to do about this? Just ask him questions about it, document it in his chart, nothing. So these are the top 4 things that I want to immediately follow up on, are these respiratory findings of insufficiency. So, and we're correct.